I'm Dr. David Lickstein, a board-certified plastic surgeon in Palm Beach Gardens, Florida, and I want to welcome you to a day in my life. People often ask me what the life of a plastic surgeon is like. So I want to take you behind the scenes today and follow me along, and I'll show you what the surgeon side is. It starts pretty early in the morning. You have to like getting up early if you're a doctor. And the first thing I'll do is have my coffee, check the overnight emails, read the news, check the sports, and of course do the Wordle. I reviewed all the cases yesterday, but I'll also go through all my notes again for the procedures, almost committing them to memory. So by the time I get into the operating room, I'm ready to go. It's about 5 after 7, beautiful sunrise this morning. When you're a surgeon, you see a lot of sunrises from work. I'm here at the hospital and getting ready to walk in. It's worth noting that the patient probably had to arrive around 5:30, so I never take lightly that surgery is a big commitment for the patient and their family. It's about this time I start to shut out all the things in the world and focus on what I get to do. One of the things I like best about my job is we focus on one thing at a time and really don't have to be distracted by the outside things when we're operating. I'll check in with you in a bit. So I'm about to go into the preoperative area. I'll say hi to the first patient and their family, make sure they don't have any last-minute questions, sign the consent form and any paperwork. And then there's a walkie-talkie system in there that they'll actually let the operating room know that I'm here so that the anesthesiologist and nurses can come out and see the patient and we'll get going on time. If you start on time, you have a better chance at finishing on time. Time to get some new scrubs, change it to a clean pair. People are always surprised to know that even we don't get an infinite supply. So this is the board that lists all the cases for the day, and I can see which room I'm in, which is operating room number 7 today. It says which my anesthesiologist will be. We'll go take a walk to the room. So the room has already been set up and good to go. It's 7:25. We're almost ready to roll. I come in, take a look, make sure I have all the materials that are needed for the surgery. The implants are here and I'll check them. I'll set up the music. People always ask, what do you want to listen to when you have surgery done? I'll listen to classic rock, some country, some rap, even the Beastie Boys. Anything that puts my mind at ease and lets me focus on what I'm doing. Always got to have a good speaker. So the next thing I'll do is come check the room. As you can see, it's ready to go. A lot of equipment, but all set up. I'll take a look at the implants and make sure I have the materials I need. My first case is a revision of a breast cancer reconstruction. Patient came from upstate for me to help fix something she's unhappy with, so excited about that. And we'll check in a little bit. I always come and say hi to Scott. Scott is the charge nurse in the operating room. His job is basically impossible. He is the air traffic controller to make sure all the cases go well and try and keep all the doctors happy. He does a great job. So it's a little after 7:30. The patient's going to sleep, ready to start the first case. It's a revision of a breast reconstruction. Probably take about an hour to hour and a half. Excited to get the day going. Finished the first case. Really happy with how that went. It's a little bit after 8:30. I'm in the dictation area in the recovery room now. It's just an area of cubicles where doctors sit down in between operations. There's some phones and computers. We have to dictate an operative note, which is almost like writing a book report on each operation or telling the story of the operation in written form. And that goes in the medical record. And then there's time to call the family, let them know everything went well, catch up on any patient issues from the office, email, or even life stuff. So I'm gonna go ahead and do that and I'll check in with you in a bit. We're just getting the room set up for our next case, cosmetic eyelid surgery, both the upper and lower eyelids. Actually one of the more technically demanding operations that we do as plastic surgeons, so I'd like to get focused for that. I'll take a look at the patient's pictures and get ready to go. It's been 11:45, case number 2 is done, went well. Probably the most technically challenging case of the day. People always ask, what else do you do during your day? I'm chief of surgery here, so I had to run down to the medical staff office behind me, meet with some people. We'll go up, try and grab some lunch, and we'll get going with the next case. It's 12 o'clock, getting ready to start case number 3, breast augmentation, one of the more common cosmetic procedures we do. Just wanted to take a look out the window, see how the weather was since we spent so much time indoors. Had a quick lunch, a salad, which we'll try and splice in. Feeling energized, ready to go for the afternoon. Well, it's 1:30. We just finished the breast augmentation. Like what you see? Have any questions or comments? Message me in the comments below.
Getting closer.
So
there is time during the day to stop by and talk to Scott. Scott, how's your day going?
It's getting better. We're getting closer to going home, actually.
Right.
And we've accomplished a few surgeries today.
So 2 more cases to go for me. Scott will be gone soon, but we want to thank him for all his help. So it's about 2:45, getting ready to start our next case. Running a little bit behind. People always wonder, how do you figure out the time? And we guess the best we can, but there's a lot that goes into it. The room has to get ready, how long a patient takes to wake up. It's an art, not a science. We don't rush through anything. So the day goes as it goes, and kind of like the airport, as the day goes on, more things can affect how the flow of cases goes, or when your airplane's late, you wonder why. So we'll take our time, we'll do a good job, and we'll keep going. So it's about 4:15, just left the recovery room. There were some questions about my last patient, trying to get her comfortable. I think that it really takes a complete team to provide a good surgical experience. I've had family members have surgery, and it really showed me that it's not just the operation I do, but the total amount of time in the hospital and all the people on the team that they interact with really makes a difference. So we're getting ready to do the last case, like the Energizer Bunny, still going, and I'll check in with you in a little bit. All right, so at 6:15, finished the last case. Sitting here, going to dictate. The 4th case was a breast reconstruction, the 2nd stage of a planned reconstruction after cancer, where implants were put in and some fat grafting was done. So we actually do some liposuction, and instead of throwing away the fat, use it to help contour the breast. And the last case was another breast reconstruction, putting in tissue expanders. So we're going to finish up some paperwork, but then we're not done. Get to head upstairs and round on the patient. We'll make some post-op phone calls on the way home, but we'll see you on the way out. So that was fun. 2nd patient today, having surgery for other reasons, that yelled hello, and I got to talk to. I think when you've been in the community for years, you get to know a lot of people. You get to see them over and over again, one place or another, and it's always nice to be a part of their care team. So it's almost 7 o'clock. I'm in the car heading home. All in all, it was a great day. I think the surgical preparation, taking the time to plan, and having some experience with these cases ensured that I had a positive impact on these people's lives, whether it was an aesthetic case or a reconstructive one. I consider myself truly blessed to have a job where I'm continuously challenged, learning, and even more importantly, get to help people, and I hope that you do too. So time to head home, hop on the Peloton, or maybe not, perhaps sit on the couch and relax, but really to enjoy the best part of my day, which is going home with a feeling that I help people and getting to see my wife's smiling face and hear all about her day. Thanks for sticking around if you stuck around to the end. If you have any questions, comments, message us below. Give us ideas for future videos. We'd love to hear what you think. Have a great night.